Hello, this is part 6 for the X-ray registry review. We're still working on the patient care section, but we're almost done. In today's video, we're going to talk about infection control. And here you have the chain of infection. We are going to start at the top with infectious agents, and then we'll work our way around, kind of like the clock position. So for infectious agents, these are microorganisms capable of causing diseases or illness. This includes bacteria, fungi, parasites, prions, and then you have your reservoirs. These are the place in which the infection agents can live, grow, and reproduce. For an example of these, you have people, water, and food. And then you have your portals of exit. These are ways in which infectious agent leaves the reservoir. For this one, you have your blood, secretions, excretions, and your skin. For the modes of transmission, these are the ways in which the infectious agent can spread from the reservoir to the susceptible host. Your portals of entry is the ways in which the infectious agent enters the susceptible host, which is your mucous, membrane, respiratory system, digestive system, any type of broken skin. And then lastly, you have your susceptible hosts, which are individuals that may have traits that affect their susceptibility and severity of disease. These include your immune deficiency, diabetes, any burns that you may have, surgery, or your age. Now I want to do like a Q&A just to kind of quiz you. This is kind of like a knowledge check. Which chain of infection is a pathogen or parasite considered to be a part of? Is it infectious organism, mode of transportation, portal of exit, a portal of entry? I'll give you just a few moments to think about it. The correct answer is infectious organism. This is a pathogen or parasite that is considered to be an infectious organism within the chain of infection. And this information came from that slide that we covered about the chain of infection. So that's the slide you can refer to. Another question, which chain of infection is where an organism can thrive and grow? Mode of transportation, portal of exit, portal of entry, reservoir of infection. The correct answer is reservoir of infection. So this is a place where an organism can thrive and grow. An example would be people, water, and food. And if I'm going too fast or too slow, you can always pause the video or like speed it up or rewind it if I'm going too fast. Okay, for our next question, a person that is at risk of an infection is called infectious organism, mode of transportation, reservoir of infection, or susceptible host. Susceptible host is the correct answer. All right, so now we'll get back to the lesson. For the mode of transmission, you have droplet contact. These are going to be transmitted through coughs, sneezes, and talking. You have droplet precautions. The purpose is to prevent the spread of infections that are being transmitted through the closed respiratory or mucous membrane contact with respiratory secretions. For contact precaution, you want to make sure that you wear your gloves, gowns, hand hygiene is performed, and then you also have an infected person touches a susceptible host. So this is how that can spread. For protecting yourself, you want to make sure that you have your mask, surgical mask, your eye protection, your goggles, face shield, hand hygiene. You want to perform hand hygiene before and after you are in contact with the patient. Patients are placed in a private room. Whenever a patient do have to go outside of their room for a walk or go down for a radiology procedure, they must wear a mask. Then you have fomite. This is an object or material that is likely to carry an infection. These include clothes, utensils, furniture. You have your airborne transmission. This is whenever an infectious agent travels through the air in small particles like your droplets and your dust. You have COVID-19 for an example, the flu virus, tuberculosis, measles, chickenpox. You must make sure that you wear an N95 respiratory mask, gloves, gowns, eye protection. Airborne isolation room is where the patient has to be in. Then you have the workers and visitors must wear a mask that is going to come in contact with this patient. For your vehicle, this is a way that microorganisms can be transported through food, through water, through blood. Vehicle should be like an easy term to remember because it's a vehicle, and then you have keywords, a way that it can be transported. So that one should be easy to remember, hopefully. And then you have your vector. These are a living organism that transmits infectious pathogens from one host to another, such as your mosquitoes. The infection is transmitted to a human from the organism's body. Now we have our healthcare acquired infections. These are nosocomial infections. You may see or hear this a lot, especially whenever you have to do like learning modules for whatever job you are going to work for. You're probably going to see this term again, but the urinary catheters are the most common route for an infection to occur. So just remember that. So what is standard precaution? You are going to hear this a lot. You may see it a lot where people say, make sure you are performing or using standard precautions. So this is a set of infection control practices that is designed to prevent the transmission of infectious diseases between healthcare workers, patients, and visitors, such as you are wearing your gloves with each patient. I know some people, I haven't seen this in a while, but probably 5 or 6 years ago, this is 2025. So about 5 or 6 years ago, I used to see people still start IVs without gloves on, but it probably was the time that they, was working in healthcare where they didn't have to wear any gloves, or if they did, they chose not to. So just make sure that you are wearing gloves with each patient even whenever because I work in other modalities, even when I'm working in the mammography department, touching patients' breasts, I am wearing gloves. And then you want to make sure that you are wearing gloves whenever there is a chance of coming in contact with body fluids. This can be tears, sweat, um, weeping sores whenever people have those sores, and you see like things coming out like pus or fluid. So always just make sure that you are wearing your mask. You want to just assume that anyone or everyone has an infection, and they may not, but this is just to make sure that you are wearing gloves so that you do not transfer any germs or infections to other people or other things like our keyboards. We have our mouse where we're clicking and typing on the keyboard, our countertops. So always just make sure that you are cleaning and wiping down your desk space and the work area and even the equipment. You want to make sure that you are wearing your mask or eye protection around chemicals, especially if they are going to splash at you or around you. And then this is also important to know, hand washing/hand sanitation is the most effective way to prevent the spread of an infection. So make sure that you remember that. You want to make sure that you are placing your uncapped needles, syringes, or all sharps in the correct biohazard container. Do not recap needles. People have gotten poked, stuck, injured by trying to recap needles. You may think that you won't stick yourself, but people have, and then you have to go get all these tests ran to make sure that you did not contract like any type of infections or viruses from doing that. You also have to make sure that you wash body substances with bleach if any contact is made. PPE must be worn if you are coming in contact with bodily fluid or substances. So you want to make sure that you are performing the proper standard precautions, which is your hand hygiene. You're using your personal protective equipment such as your gowns, your face masks, of course your gloves. Do you need a respiratory hygiene for airborne precautions if someone is likely to have TB or, you know, hepatitis? Make sure if you do have to cough, um, they have been teaching like healthcare workers to try to like cough or sneeze in their arm because you're not actually coughing on your hand. And then make sure that, like I was saying, place your sharp needles in that red bin for the biohazard container. And if it is full, make sure that you are calling someone from biomedical so that they can empty the biohazard container so that no one does not get poked. Clean down all patient environment, tech work environment. Now we have two confusing terms. Make sure that you know these terms, know the difference, because these terms, medical sepsis and surgical sepsis, it get a lot of people confused. Believe it or not, it seems like it's something easy to remember, but a lot of people get confused by these terms. So for medical sepsis, this is the ability to minimize the risk of infection by preventing the spread of microorganisms. You want to disinfect your workspace. Disinfection can be done through water and chemicals. Do not wear artificial fingernails because germs and you just never know what can live under those nails, food, dirt. Make sure that your real fingernails are like cut down the appropriate length. Use hand sanitizer for about 15 seconds, 15 to 20 seconds, or until your hands are dry. Wash your hands for 20 seconds. Turn off the faucet with a paper towel because I see people or I hear about people washing their hands and then whenever they get ready to turn off the faucet, they touch the faucet with their hands. Well, your hands are back dirty again. So turn off the faucet with the paper towel. I'm sure you know this, but just in case you don't, because I still see it happening, open the bathroom door with the paper towel. Even if your hands are clean, the bathroom door is dirty. The handle is dirty. For surgical asepsis, this is the complete removal of all organisms from an environment or equipment. A complete and thorough sterilization of the equipment is required for this. So just make sure you know the difference. You think, or you may know it, but a lot of people get confused with these terms. We have another Q&A. A lot of people enjoyed this on the last video I made, so that's why I want to just throw it in again, just to kind of test your knowledge in between. If you enjoy these Q&As, can you let me know in the comment box if you want me to keep putting them in the video? I know for the other 3 or 4 patient care videos I made, I didn't have Q&A in there. So if you enjoy these, can you let me know in the comment box and I can try to put more in the other videos. The complete removal of all organisms from an equipment or environment is called droplet precautions, medical asepsis, standard precautions, or surgical asepsis. Surgical asepsis is the correct answer. This is the complete removal of all organisms from an environment or equipment. Medical asepsis is the ability to minimize the risk of infection by preventing the spread of microorganisms. The ability to minimize microorganisms as much as possible is called, is it droplet precautions, medical asepsis, standard precautions, or surgical asepsis? Medical sepsis. This is the ability to minimize the risk of infection by preventing the spread of microorganisms. Surgical sepsis is the complete removal of all organisms from an environment or equipment. So now we have our sterile glove application. This is whenever you have to put on sterile gloves whenever you are working in radiology performing procedures. So for step one, you want to make sure that you wash your hands with soap and water for at least 20 seconds. After that, you want to dry your hands with a paper towel. And then once you are done with that, you want to place your sterile gloves package on a clean surface. So for step four, using a non-dominant hand, you want to grab the inside of the first glove. So if you're right-handed, you want to make sure that you use your left hand, which will be your non-dominant hand. For step five, slip on the glove or the sterile glove, and then you want to make sure that you do not touch the cuff because you can readjust the cuff whenever you put on the other glove. And then you want to make sure that you are sliding on the gloves, making sure that it is covering your wrist area as well without touching the outer part of it. So you want to kind of like the picture's doing on step 7, cuff the glove under that cuffing part. Do not touch your hand or the inside of the glove that is folded. And then once you adjust the glove, you can just slide it down, like covering your wrist. Okay, so for our sterile field and technique, always check to make sure that the sterile package is not expired. You just never know. It may have been someone else's job to check this. Maybe they forgot or became busy. So always make sure that the expiration date is correct. Place the sterile pack on a clean table. After the package has been opened, unfold the first corner of the pack away from you. So don't fold it to you, fold the first corner away from you. Do not touch the inner surface of the sterile package or the towel. So even if you have like on those regular gloves, that's not sterile gloves, the one that you grab from the box, those gloves are not sterile because people or healthcare workers, they sometimes they grab more gloves than what they need and then they push it back in the box. So those gloves are not sterile. I've seen like blood stains on gloves that were pushed back in the box because someone, probably had accidentally touched it or it was contaminated by by the tech's hand. So make sure that you are, you know, watching your gloves whenever you're pulling it out the glove basket or the glove box. Sterile objects are considered contaminated and must be thrown away when they are touched by a contaminated object. Do not reach across the sterile field. If you have to adjust something on the sterile field or the sterile paper, just go around and do it that way because you don't want to reach over and touch anything. Do not leave your sterile tray unattended. You never know who may accidentally walk in the room or who may think there's something else on the table and contaminate the sterile field. Do not turn your back away from a sterile field because you don't know if someone may drop something on that sterile field or you just never know what may happen. And then a lot of places make you wear like a hairnet and then a mask whenever you are preparing your sterile field. So just keep that in mind. And then just remember only the waist up and the front of your protective gown is considered sterile. For your isolation patients in radiology, your isolation patients should not be waiting in the hallway, especially for a long period of time. They shouldn't have to wait in the hallway for a long time, especially because someone else can get contaminated by them or sick. There should always be a dirty radiology tech and a clean radiology tech taking the x-rays on isolation patients. One normally stay in the room and handle like anything that's like around the patient, like any dirty items or when they come in contact with the isolation patient. You have one dirty tech and then you have one tech that is clean that's not going to touch the actual protective case around the cassette. They're going to just kind of like pull it out from the x-ray cassette. So instead of touching the contaminated bag from the other tech, they just gonna reach their hand in and pull out the cassette. And then you see how everything is like covered nicely so that they do not have to wipe down as much. They still are going to wipe down the machine, but a lot of the x-ray machine would not be contaminated. And then always clean the x-ray machine and the cassette. Use a cassette covering. Wear 2 pairs of gloves if needed to avoid having to go back to where the gloves are and grabbing more or contaminate your hands. So if I know I'm working with an isolation patient, I'm going to have at least 2 or 3 pairs of gloves on so that if one of my gloves get dirty, I can just pull the other one off and not have to worry about putting on new gloves. Always wash your hands before and after you are in contact with a patient, especially an isolation patient. We have another Q&A, just to kind of test your knowledge in between. How many seconds should you wash your hands for? 10 seconds, 15 seconds, 20 seconds, or 30 seconds? Oh, this is always a tricky question too. The correct answer is 20 seconds. So it is recommended that you wash your hands for at least 20 seconds. This includes washing the palms, back of your hands, between your fingers, under your nails, and your wrists. Turn off the faucet with the paper towel. All right, that's it for this video. I'm close to being done with the patient care videos. I know you all are studying and you probably want to see other topics or other lessons with X-ray, but I'm trying to go in order because I know it's probably going to be a lot of videos that I'm going to kind of get out to help people pass the X-ray registry. So that's why I'm trying to go in order and follow the content specification through ARRT website, but you can use it for any boards that you are studying for. So that's why I just didn't want to jump all over the place and make different videos, and then people are trying to find a certain topic. So that's why I'm trying to stay in order, but I'm almost done. I promise you, I'm almost done. Probably maybe 2 or 3 more patient care videos. I'm trying to like break it down because I know some people may have like a short attention span. So that's why I'm trying to like just break it down in like bite-sized pieces for you all. But if you enjoy these videos, please give it a thumbs up. You can leave a comment. Please like, share, and subscribe for more videos so that you do not miss anything. And once again, thank you all for watching. I appreciate your support, you thumbing up the video, you commenting on the video. So I will see you all in the next video. If you would like a part 7, just let me know. Bye.